for the people who. Okay, so before we get started, I want to mention the mask mandate for the Bay Area. So if you're in San Francisco or the other Bay Area counties that are reinstating the mask mandate, you should wear a mask in all indoor settings. And then this is because of the Delta variant. So it's important to be safe and to protect yourself against the Delta variant, whether you're vaccinated or not. So just to put that out there so everybody knows. So before we get started, we wanted to know if you guys or anyone you know have allergies and what types of allergies you've heard about. So you can put this in the chat and then I can like read it out loud. Okay, so we have pollen. Yeah, I think that's really common, like especially during the spring when there's like a lot of flowers blooming. Anyone else? Yeah, dust and peanuts. I know I have a lot of friends who have severe peanut allergies, so. Oh, okay, and hay fever. And then Band-Aids, Patrick, you said? Yeah, I think maybe it might be that the Band-Aids contain latex, which we'll talk about a little bit later. Okay, and then also dust and pollen. Yeah, those are some really common ones, and we'll definitely be going over those a little bit later in this slide presentation. Okay. Yeah, your brother's allergic to peanuts. Yeah, that one's really common. So before we get into like the actual presentation, there are a few terms that we'll be using. I just wanted to make sure that everyone understands them. So an epinephrine autoinjector is also known as EpiPen for short, and it basically blocks the progression of an allergic response by constricting the blood vessels, which leads to increased blood pressure and decreased swelling. And the other term that we'll be using a lot is allergy shots, and these are regular shots that are given over a period of time to stop or reduce allergy attacks, and these are usually given over 3 to 5 years. Okay, and then now we'll be introducing what allergies are.
Yeah, so we'll start off by covering what allergies are. These are your immune system's response to unfamiliar substances that usually aren't harmful. The substances that cause these reactions are called allergens. Some examples of allergens are cotton and pet dander. Normally, your body doesn't react to allergens like pet dander because it realizes it's harmless. But for people with allergies, their body sees it as a threat and tries to attack it. Next, we'll go over symptoms of allergies.
Now we'll get into symptoms or side effects of allergies. Different types of allergies will lead to different symptoms. The symptoms that arise from allergies also depend on how severe the allergy is. Starting with food allergies, if one has a food allergy, they might experience hives, nausea, swelling, dizziness, tingling in the mouth, or fatigue. The more severe the allergy is, the more serious the reaction will be. However, many people can go throughout their life not knowing they have a food allergy until they eat a certain food, but it's important to seek medical help if any of these symptoms occur when eating food. Next up is seasonal allergies. The symptoms of seasonal allergies are similar to those of a cold, including runny nose, sneezing, congestion, and swollen eyes. The symptoms of seasonal allergies are typically mild and can be treated with over-the-counter medications. But of course, if they become severe, seek medical help. Last up is severe allergies. Severe allergies can cause symptoms such as lightheadedness, difficulty breathing, and even loss of consciousness. These symptoms point to anaphylaxis, which is a life-threatening allergic reaction. If you come in contact with a possible allergen and start to experience these symptoms, you must seek medical help right away. As you can tell, there are many different symptoms of allergies. However, they all vary depending on the person and allergy. Next, we'll talk about skin allergies.
Skin allergies usually result in rashes on your skin, caused by allergic reactions. Some types of rashes include eczema, hives, and contact dermatitis. Eczema is an itchy inflammation of the skin, which causes rashes most commonly on the arms and behind the knees. Children and those with a family history are more likely to develop eczema. Hives are a skin rash caused by an allergic reaction to medicine and food. Hives look like red, welt patterns and are itchy. Finally, contact dermatitis is a skin rash from irritants, most commonly soap, cosmetics, fragrances, jewelry, and poison ivy. We'll now talk about allergy triggers and causes.
Now we move on to our first allergy trigger / cause, pollen. Pollen is something that plants produce during spring to spread to other plants to be able to reproduce, which through a variety of ways. The most predominant being spread through the air, which is where we as humans come into contact with it. Symptoms of a pollen allergy are fatigue, itching in the face area such as the eyes, nose, or the roof of your mouth, runny nose, sneezing, watery eyes, redness, or swelling. To prevent a pollen allergy, you essentially want to limit or shield yourself from the outside air, which can contain pollen. Doing things like closing the car window, limiting the time spent outdoors, wearing a hat and glasses, and taking a shower such as bathing to completely wash the pollen off of yourself. All this during the pollen season, of course. When there's no pollen, you don't need to do this. Much like other allergies, there are remedies to these symptoms such as antihistamines, which eliminate the chemical histamine that your body produces during an allergic reaction. Decongestants for your nose, nasal sprays, and other types of allergy medicines that mitigate these symptoms. That's it for pollen. Now we move on to dust mites.
Now we'll be moving on to dust mite allergies. Dust mite allergies are allergic reactions to very small bugs that are usually found in house dust. Symptoms of an allergic reaction to dust mites include sneezing, coughing, having a runny nose, postnasal drip, having itchy, watery, or red eyes, swollen skin under the eyes, nasal congestion, and having an itchy throat, tongue, or roof of mouth. To prevent or avoid having an allergic reaction to dust mites, make sure to have dust mite covers over mattresses and pillows, wash sheets in hot water every week, and keep all areas of the house free of anything that collects dust. Treatment for this allergy includes OTC antihistamines, which block histamine, which is released by the body when the body encounters an allergen, decongestants, which would break up mucus caused by the allergy shots, which will help build immunity over time, and prescribed allergy medications to help reduce the symptom and prevent having an allergic reaction. That was all for dust mites. I hope you learned something new. We will now be moving on to mold.
Mold are tiny fungi with pores, and like pollen, they float in the air. The symptoms and treatment are similar to the symptoms and treatment of dust mite and pollen allergies. So the symptoms include sneezing, congestion, itchy and watery eyes, runny nose, and coughing. To avoid a mold infection, avoid contact with mold and anything that encourages its growth, which is usually like dampness or wetness. So in order to prevent that, repair all water damages / leaks in your home, and avoid plants inside your home, as the soil which the plants grow in can contain mold. Also use a dehumidifier to make sure that the place is completely dry. And in the fall, wear a mask while raking leaves, as that can contain mold as well. That's it for mold, and we'll be moving on to animal dander and cockroaches.
So dander are flecks of skin shed by cats, dogs, and even birds that can trigger allergies. People may be allergic to the proteins from oil glands in an animal's skin or the proteins from an animal's saliva. It may take 2 or more years for you to develop an allergy like this, but once you have symptoms, they may last until you don't come into contact with the animal anymore. If you don't have pets, you might be allergic to cockroaches. And symptoms of an allergy to animal dander and cockroaches include sneezing, congestion, and itchy and watery eyes. To prevent this allergic reaction, avoid the animals that cause your allergies when possible. If you're allergic to your pet, you can ask your doctor if there's anything you can do that would help, like keeping it off your bed and couches. You should also bathe your pet every week and try to get someone who isn't allergic to do it. You can also take medications such as antihistamines, decongestants, nasal steroids, and allergy shots to help. If you have cockroach allergies, keep trash in closed containers and take it out of your home promptly. You may also want to consider getting an exterminator.
We'll be now looking at insect stings. So I'm sure we're no strangers to pesky mosquitoes and their itchy bites, but some people can get severe allergic reactions to other insect bites. I'm sure you've heard of various bee species as being the most common culprits, but there's also fire ants, yellow jackets, hornets, and wasps. Normally, if you ever get bitten by those bugs, you'd experience some pain, some swelling maybe, some redness and heat on the sting site. But some people can get anaphylaxis from insect bites, which is pretty rare, but it's still best to know the symptoms, which include trouble breathing, your voice becoming hoarse, wheezing, swelling, especially around the face, eyelids, ears, mouth, hands, or feet, so anywhere that's not near the sting site, belly cramps, nausea, vomiting, or diarrhea, and feeling dizzy or passing out. So to prevent all of that from happening, be unattractive to insects, that is. So meaning you should avoid brightly colored clothes and anything that's scented. It's also good to bring insecticide and wear shoes when you're outdoors. And also stay away from places where there's food. Like if you're at a picnic, stay away from the outdoor garbage, honey, lemonade, etc., because those attract insects. Also talk to your healthcare provider about allergy shots to prevent anaphylaxis. If you do end up getting stung, try to safely remove the stinger and orally take antihistamine to reduce symptoms. You can also try a pain reliever and an ice pack combo to dull the pain. But if you have symptoms of anaphylaxis, you need to get an epinephrine auto-injector like your EpiPen and call 911 for emergency treatment. We'll be now looking at latex.
Some people are allergic to latex and materials that contain latex. These include gloves and elastic orthodontic rubber bands used for braces. Symptoms of this allergic reaction include itchy red skin, teary, irritated eyes, runny nose, sneezing, coughing, and wheezing. People who are allergic to latex can also have anaphylaxis, but it's not common. Next, the treatment for latex allergies include antihistamines or an epinephrine autoinjector like an EpiPen. To prevent this allergy, you should avoid anything that has latex in it and wear a bracelet that lets people know that you have a latex allergy. For example, you should avoid using latex gloves and notify your orthodontist if you're allergic to latex. Let's go on to food allergies. Now we'll go on with food. Food allergies are pretty common. You might even know a friend with a food allergy, such as to peanuts or eggs. What happens during a food allergy is that you'll get mild to severe allergic reactions to the food within minutes of injection. Some common foods people have an allergic reaction to is milk, fish, shellfish, nuts, soybeans, wheat, and eggs. When someone does have an allergy to food, they can develop symptoms of wheezing, complications with breathing, hives, vomiting, diarrhea, swelling around the mouth, and the symptoms we've mentioned in the beginning. For some people, they have severe allergic reactions that can lead to death, which is called anaphylaxis. Luckily, we can avoid these fearful symptoms by avoiding the food and checking the allergy with our doctors. That way, you can work around the food allergy and still eat food high in nutrition. If you accidentally consume the food you're allergic to, there are some treatments. For mild reaction, antihistamines like Claritin can alleviate your symptoms. For severe reactions, you would use an epinephrine autoinjector, or commonly known as EpiPen. I highly suggest carrying around an EpiPen if you have severe allergic reactions, or even learn how to use an EpiPen in case you or your friend are having a severe allergic reaction. That's all for food allergies. Let's move on to drug allergies.
And so some people are allergic to certain medicines or ingredients that the medication contains. This includes penicillin and aspirin, and symptoms can range from a mild to severe reaction. They can also appear immediately or after a few days after you consume the medication. Serious symptoms include hives, itchy eyes and skin, flushing, belly pain, nausea, vomiting, swelling in the mouth, throat, hands, and feet, and feeling lightheaded or passing out. These symptoms are concerning because they can lead to anaphylaxis. For serious reactions, including anaphylaxis, you need to call 911 and you may be hospitalized. For milder symptoms, your doctor may give you an antihistamine or steroids. And to prevent drug allergies, you should talk to your doctor if you know or think you have a drug allergy and complete allergy testing if needed. And next we'll talk about allergy treatments.
Now let's move on to different allergy treatments. Usually staying away from what triggers an allergy reaction is enough to avoid it, but sometimes treatment is necessary. The first option is medication. Examples of this include antihistamines like we talked about earlier, or Benadryl, corticosteroids, Zyrtec, loratadine or Claritin, cromolyn sodium or gastrochrome, decongestant like Sudafed, and leukotriene modifiers like Cyflo. The next option for treatment is immunotherapy. This is when the body gets several injections over a few years to try and get the body to be more used to the allergy. Another treatment is emergency epinephrine. This is a shot that counters allergic reactions before medical help arrives. Common brands are EpiPen and Twinject, and it's also a good idea to keep an emergency allergic reaction first aid kit. The final treatment option are natural remedies or supplements that often have other allergens, so make sure to check with your doctor before using them. An example is if you start sneezing around certain plants or flowers, some dry teas have flowers and plants that are similar to those that may trigger your allergy. Now let's learn about allergy testing.
The first allergy test we'll talk about is the blood test. Allergy blood tests detect and measure the amount of allergen-specific antibodies in your blood. When you come into contact with an allergy trigger known as an allergen, your body makes antibodies. These tests usually screen for at least 10 of the most common allergy triggers, including dust, pet dander, trees, grasses, weeds, and molds related to where you live. They're also particularly helpful in diagnosing food allergies. There are two types of allergy blood tests: the enzyme-linked immunosorbent assay, ELISA or EIA, and the radioallergosorbent test, RAST. The allergy blood testing is recommended if you are using medicine known to interfere with test results, cannot tolerate the many needle scratches required for skin testing, have an unstable heart condition, have poorly controlled asthma, have severe eczema, dermatitis, or any other severe condition, or have extreme reaction to skin testing. Next, we'll talk about the skin test. The allergy skin test involves applying an allergen extract, such as dust mites, pollen, mold, or food, to the skin of a patient in order to provoke an allergen reaction, in which a reaction indicates the patient is allergic to the specific substance. The type of allergens used in the allergy skin test are first chosen during the consultation with your physician, after which they may schedule an appointment for the test at a later date. This type of test is appropriate for use with patients of all ages, including infants. These tests can test for grains, meats, eggs, milk, seafood, and dust. During the test, first the nurse will mark areas on the skin of your arm or back and label them for the types of allergens that will be used in the skin test. Then, a drop of allergen extract will then be applied to each mark, and a small lancet will be used to gently prick the extracts into the skin. In approximately 20 minutes, the results can be read. The type of allergens chosen for use in the skin test are dependent on the medical history of each individual patient. After, if the patient is allergic to a certain substance, a raised reddish spot called hives will develop along with possibly some mild itchiness at the test location on the skin. The size of the redness will only be about 2 milliliters and will usually disappear within a few hours. Here is a skin test example of how the nurse or physician may mark your skin.
Okay, I think a lot of people have noticed the Kahoot tab at the top of the screen. But before we get into that, does anyone have any questions that they'd like to ask? Or any slides that they'd like to go back to? You guys can put this in the chat, and then I'll just quickly go over the next session and then some logistics about next semester so that we can get into the Kahoot. But yeah, you guys can feel free to like drop it in the chat if you'd like. So the next session will be on August 15th at the same time, so 10 a.m. to 10:40 a.m. And we'll be talking about mutations. So basically like what they are, causes and effects of mutations, and then also like diseases that are passed down from parents to offspring, so like their children. And so these include like cancer, diabetes, sickle cell, anemia, etc. And then we'll also talk about advancements in genetic engineering that allow doctors to treat patients who have genetic diseases. And then for the fall semester, these are the programming dates that we have. So we have September 12th, September 19th, September 26th, October 3rd, October 17th, October 24th, November 7th, and November 14th. So we'll be skipping October 10th because I believe it's Indigenous Peoples Day, and then also October 31st because that's Halloween. So you guys can feel free to like take a screenshot of this. We'll also be emailing this out. And then for this semester, or for the next semester, the theme will mostly be centered around physiology and anatomy. So basically, anatomy is like the internal and external structures of the body and their physical relationships, while physiology is the study of the functions of these structures. And we'll explore this topic more in depth next semester and hopefully invite some speakers. And as I mentioned earlier, we'll be sending out like more information through email in the coming weeks. So if there are no questions, I think we can move on to the Kahoot. Okay. Okay, so the game pin is 3288004. Yeah, so you guys can join. I think we'll wait a couple minutes for people to join. Yeah, I feel like every single time I play this, someone named Gamerfish. That's cool. Okay, just to make sure that we have enough time for the questions, I'll just start the game, but then you guys can join because the game pin will be at the bottom of the screen. Okay. So the first question is, what does an EpiPen do? Block progression of an allergic reaction, constrict blood vessels, decrease swelling, or all of the above? Yeah, so the main function is to block progression of an allergic reaction, but in the process of doing so, it also constricts your blood vessels and it decreases swelling. So the correct answer is all of the above. Okay, so we have Triple Jinxed on the top, Gamerfish, Sarah, T, and then Nor. The second question is, which one is not a type of skin allergy? So there's eczema, hives, acne, and contact dermatitis. Oh, is Ryan Gamerfish? Yeah, so acne isn't a type of skin allergy. I think in one of the slides we mentioned that eczema, hives, and contact dermatitis are types of skin allergies, but that didn't include acne. Oh, okay, now Gamerfish is at the top, and then we have T, Nor, Riley, and Elephant. Okay, the next question is, how often are allergy shots given? Regularly over a period of time, once a year, once during the allergic reaction, or twice during 1 year. Okay, yeah, so it's given regularly over a period of time, and this is usually 3 to 5 years. But the once during an allergic reaction, I think that one applies more to the EpiPen if it's a severe reaction, and the other two are false. Okay, we have T and then Riley, who has a streak of 3 correct answers. And then we also have Gamerfish, Sora, and then I think it's a dash. Okay, the next one is a true or false question. Symptoms of seasonal allergies are similar to common cold symptoms. And then you just answer true or false. Yeah, the answer is true. I think we mentioned that in one of the slides at the beginning. Okay, I think the top 3 positions stayed the same, and then Dash and Sora switched. And then 3 players also hit answer streak of 3, so congrats. Okay, the next question, what are ways to treat allergies? Medication and or natural remedies, immunotherapy, and emergency epinephrine shots, or all of the above? I think the 2 are switched at the bottom. Okay, yeah, it's all of the above. I think almost everyone got that right. I think the medication and or natural remedies is really common, so maybe that's what people were thinking. Okay, and the leaderboard just stayed the same. And then congrats to those who hit the answer streak of 4. Okay, the next question is, what are allergies caused by? So there are dander mites, allergens, dermatitis, or none of the above. Okay, so allergens is the correct answer. Allergens are like things that trigger allergies. Dander mites isn't a thing. It's either dander, which is the things that are released by pets and birds, or I think maybe dust mites. Maybe people might have gotten the 2 confused. And then dermatitis is a type of skin condition that's related to allergies. Yeah. Okay, so I think the leaderboard did change a little bit. We have T on top and then a dash. We have Sora with 5 correct answers in a row. We have Sarah and then Riley. Okay, the next one is true or false. Allergy testing includes a skin test and a nasal test. Okay, yeah, this one is false because it does include a skin test, but the other test is not a nasal test, it's the blood test. Okay, and then we have T still at the top. Sarah, who has a streak of 5 correct answers in a row, Riley, a dash, and then Sora. Oh, that's interesting. You have to get a blood test on Monday. Yeah, that's cool. Is it for an allergy or is it like something else? Oh, okay. That's really cool. Yeah, thanks for sharing that. Next question we have are, how are allergen extracts determined during an allergy skin test? So the patient's medical history, everyone receives the same extracts. It depends on what the extracts are available and none of the above. Okay, yeah, it depends on the patient's medical history. And then also I think where they are, there might be different types of plants or like things that may cause allergies. Yeah, I think the leaderboard is kind of similar to what we had before, but we have T at the top, Riley, Tash, Sarah, and then Noor. Okay, the next one is a true or false question. Allergic reactions happen immediately. Yeah, this one is false. Good job. A lot of people got this one right. This one is false because some of the pet dander one that can take like years to develop, and then the allergies to like medication that can like happen a few days after you consume the medication. So it's not always immediately, but I think a lot of allergic reactions do happen immediately, like the food allergies and stuff. Okay, so that's the leaderboard. And for our last question, it's not really based on the allergy presentation, but it's just what would you like to see more of next semester? So we have like original presentations like this one, and then also like speaker sessions like the ones that we had like a few weeks ago. And then we have the weekly med articles and then Kahoot reviews. Okay, so a lot of people like the Kahoot reviews, so we'll try to incorporate those in our sessions. And then we also have some people who want original presentations and speaker sessions. But there are a lot of votes for Kahoot reviews, so we'll try our best to do that. And they're like really engaging ways to like review the material. Someone type something in the chat. Oh, okay. We want to see the results. All right, so here's the podium. We have Dash in third place, 8 out of 10, and then Riley in second place, 9 out of 10. And then for our first place winner, we have T. Oh, it's Trisha. Okay, congrats. And then in fourth place, we have Noir, and then fifth place, we have Gamerfish. Yeah, good job. You got into top 5. Okay, yeah, I think that's all we have. Okay, yeah, so thank you. We'll be sending out like the details about the fall session. Like I said earlier, we'll also like send out the recording and the recap. But that's all we had. I think we have a little bit less than a minute. So let everybody go. Have a great weekend. Yeah, thank you.